Hey guys, we're going to talk to you about something new today that really hasn't been touched on at all in any of the previous vlogs, and it has to do with how we manage one particular part of labor, and that is when the mom has become completely dilated and it's time to either push or rest. So immediate pushing, just get complete, start pushing, work on having a baby. Delayed pushing is where you hang out for a while, 30 minutes, an hour, sometimes longer. The question is that good or bad? Is there any evidence that tells us one thing is better than another? There's a study that came out last year that I think is informative, and I wanted to try to discuss it with you and explain to you what it means, because this is one of those things that when you're in labor and you get complete, sometimes the doctor may have a preference, the nurse may have a preference, they may ask you if you have a preference. But if you don't know what the implications are of these decisions, then it's hard for you to make an informed decision about this, and it turns out it's kind of important. So just to give you some basic information for starters, the study that I'm referring to was published last year, and it studied about 21,000 women. So this is a big study. A lot of patients were involved. It was across multiple different hospitals across the country. So when we talk about studies, we say that's a pretty good study from start because it's got big numbers and it's taken from hospitals all across the country. So we would say that's more generalizable. It means more to just the average person. It's not some specific population. So 20,000 people across the country were studied. They were all first-time moms. They had an epidural. So this is not moms who are laboring naturally, unmedicated. This really does not apply. And that's an important fact to remember. So this is purely talking about moms who have an epidural. It's their first baby. They've become completely dilated. And the question is, now what? So they looked at the differences between moms who pushed within basically right away, which is 0 to 30 minutes, or 60 minutes or longer. So those are the two groups they looked at. And there were about 20% of the patients that delayed their pushing, and the rest started pushing pretty much right away. And so based on this information, these are the facts that were gleaned. The amount of time from when the patient was examined and found to be completely dilated until she had the baby was longer if you waited to push. And that makes sense, but it was about twice as long. So the numbers went like this: just over 3 hours in the delayed pushing versus an hour and 20 minutes in the immediate pushing. So basically twice as long. Also, the amount of time that the mom pushed was longer in the group that delayed starting pushing by about 10 minutes. So not a huge difference there, but technically they waited longer and they pushed longer. Now, that might not be such a big deal if that's all there was to it. What we really care about is what's the C-section rate from one group to the other, and are there any other complications? And the answer is there's a difference. The C-section rate was twice as high in the group that waited to push. So that's a substantial increased risk for C-section. Double the risk by just waiting to start pushing. It was also noted there's about a 25% higher chance of the need for what we call an operative vaginal delivery. So that's forceps or vacuum in the group that waited to start pushing. There was also about a 40% increased risk of postpartum hemorrhage, so significant bleeding after delivery. And there was about a 50% increased risk of need for a blood transfusion. And the other thing to keep in mind is that delayed pushing was shown to have no benefit to the mom or the baby. So maybe there's some other things that would be good about waiting to push, but the study could not find any of them. So there was no benefit to the baby, there was no benefit to the mom, pretty much just increased risk of C-section, operative vaginal delivery, bleeding, and need for transfusion. And there was also an increased risk, not as high, but still an increased risk of more severe lacerations, tears at delivery. So these are substantial numbers, and if I didn't know better, it would be logical to think, well, maybe I should wait a while because, I don't want to push for 2 or 3 hours and finally have this baby when I could rest for a while. And the idea is that the uterus is going to contract and labor is going to naturally bring the baby down. That all sounds really good, and it's been done a lot. And I've had plenty of patients that did it. But the new thing is this information's out there now, and it does show a higher risk of C-section and a higher risk of operative vaginal delivery. So at a minimum, I think if you're going to make that decision, you should be aware of that information before you decide one way or the other. It's interesting to note that it's the exact opposite of what would happen if you were a mom who's laboring unmedicated. When you get completely dilated, you're going to push. You can't not push. So delaying pushing is actually doing the opposite of what would naturally happen. And the only reason that that happens is because if you have an epidural, you're comfortable enough to delay the pushing. But my point is, it's the exact opposite of sort of the natural way of doing things. So I guess it's not a big surprise that maybe it increases the risk a little bit. Now, the last thing to tell you is that this does not prove these facts beyond a shadow of a doubt. This was a very large observational study across multiple different hospitals across the country. So in those regards, it's a good study. But it's not the same thing as a randomized trial where you take moms who are now completely dilated and you flip a coin. You either start pushing or you wait. That's underway now. So there is a trial, very large, multi-center trial that is assessing this exact question as we speak. Now, obviously the results aren't in yet, so I'll do an update to this video when those results are published. I'm not sure when the study's going to end. Most of these big trials take a couple years to get done and another 6 months to a year to crunch all the data and get it published and peer reviewed before it comes out to the medical literature. So it may be a while before we know the results of that trial. But when and if that becomes available, I'll definitely update you. But for now, just be aware, maybe we shouldn't rush to adopt this just wholesale for everybody because perhaps there's some increased risk. And if nothing else, then I'm glad I could give you the information and you can make a more informed decision when that time happens for you when you're having your baby. Take care, guys. Have a good day.